Hi,
Hi,
Jan.
Ben.
There.
How are
Hello,
you?
hello. Hello, Dr. Cheng. Hello, Kennedy.
Hi, how
Yeah.
are you?
Hi, Dan. We're
I'm
super
good. How are
excited.
you guys?
We're doing great.
We're doing really well. We're doing really well. Yeah. How was your past week?
It was good. Whenever we have a holiday like yesterday, I keep thinking today is Monday, and it's not.
Yeah.
It's Tuesday, so I lost a day this week, but I had a nice weekend.
Good.
Nice.
Yeah.
Well, thank you so much for being here with us today.
My
Um,
pleasure.
I think I'd just share a little about you for maybe some people out there who don't know. But just wanted to share that Jan is a legend professional in the professional skincare.
Thank
The
you.
OG of skincare.
With over 50 years, I believe, in the industry. So
Yeah.
amazing. And she's widely recognized and endorsed by the medical community for her innovative technologies, holder of multiple patents, and was named one of New Beauty's top 20 innovators in aesthetics. She's also a respected and sought after speaker at medical conferences, both in the US and around the world. So we're so excited to have you here today with us. Um, Speaking about a really important subject, acne, which I think affects so many people. And so we're just happy to learn from you.
Yeah.
Well, I love talking about acne because literally it affects everyone, but
Yeah. I mean, I've heard of your story, so I'd actually like to hear your acne journey because I have my own that I'm glad
sure.
it's over with. But yeah, tell me about your acne journey and what led you to really one of the
Sure.
main reasons you started your research company, right? Your skincare company. So
Well, it wasn't a reason. I've always been obsessed.
yeah,
I don't know why, but to kind of preface my journey, let me just say this. Acne is an epidemic today, and that's an actual medical fact.
right.
And individuals that are in their 20s, 30s, 40s, 50s, and beyond suffer from acne. And so many people will say, well, I had it when I was a teenager, but it was pretty mild. And then when I got into my 20s or my 30s, et cetera, it came back with a vengeance. Or my acne cleared up when I was pregnant, or my acne got horrible when I was pregnant. And it goes on and on. And the interesting thing is, guys, is that when you ask people, well, when do you think acne starts? Commonly, they'll say, I don't know, 11, 12, 13. The average onset of acne today, now think about this, the average onset is 34 years old. That
Wow.
means you could have clear skin for years and maybe you're going toward perimenopause or there's a number of factors that might trigger it. But the fact is that, and this is part of my story too, is that we are faced with very few options. You go to the drugstore, you can see a whole entire aisle of acne medications. Every adult woman will tell you, they dry my skin, they make it look red, I put my makeup on, I look scaly. And when we, as females, we also have other concerns. We might have brown discoloration. We might have rosacea. We might have fine lines and wrinkles, large pores. So what we're going to be talking about today is a way to address all of that and be able to um, not leave out all of these other issues that are really important. Now, with regard to me, I was one of those anomalies that I had perfect skin as a teenager. I never had a breakout.
Wow.
That's literally only 1 to 2% of the population. When just before I turned 19, and I actually happened to be at that time modeling and doing some television commercials, I developed severe cystic acne.
Hmm.
And no different than anyone else, I tried everything that was in the marketplace. And it was very common back then, if you saw a dermatologist, that oftentimes you would say to your dermatologist, well, what should I be putting on my face? Will makeup make it look worse? Is there something I should be using? And it is very common for someone to say, stop using everything. And that's not realistic. And so that was one of the things, though, that led me to become an ingredient expert. And it wasn't the reason that I actually moved forward in this industry, but I became an ingredient expert. And I eventually also became a 2-time Accutane failure. Now, when I first went on Accutane, I was in one of the last test groups connected with Stanford University before it was approved for full prescription use.
Oh, wow.
And miracle, my acne cleared up. My skin was absolutely beautiful. It was flawless. And not that long after, it came back. Now, maybe not quite to the same extent, but I went on Accutane again. And most of you don't know about Accutane dosage, but what I can tell you is, I think at the time I weighed about 106 pounds, and I went on 110 milligrams a day, where the average is 40. Went away, cleared up beautifully, and then my acne came back. And when you think about this, particularly those of you who are practitioners, how many times have you seen somebody, whether they've been Accutane once, twice, or numerous times, where their acne is better, but they still have acne, they still break out? And Accutane is not a cure for acne. Statistically, what it does is it puts people in remission. And there are actual statistics having to do with how many people have clearing, how many people maybe don't even get completely clear. And it's different for each person as to how long they're clear, but typically there's some return of the acne. Now, I'm not leaving men out of this equation, but men typically do not have acne past the age of 23. Now, there's some exceptions, but that's when men reach what we call terminal beard growth. The beard reaches its full diameter, pushes everything out of the follicle. And I'm sure, Kennedy, within your patient population, you don't see that many men that have acne as opposed to women. And I want to make something else clear. People will say, well, I don't have acne, I just break out once in a while. If you break out once a day, once a month, 10 times a day, it's all acne. It's the same exact process. And clogged pores, blackheads, bumps under the skin, closed comedonal acne, that's all acne. I say to people, well, if you take your skin and do this, can you feel any bumps? So, and that's usually something that's sitting there that can become a lot worse. So it's all acne, and it is an epidemic, but we can manage it.
Can you walk us through?
By the way, one thing I want to add to that, excuse me,
yes,
is today I have complete total clearing. I manage it. Now, if I didn't do what I do every single day without fail, maybe there would be 2 or 3 days where I can get by, but I would break out. No one has ever seen me with a breakout. You don't even see my pores. I manage it, and that's important. We'll get more into that. I manage it.
Can you kind of walk us through how acne begins and what's happening, with the skin when that?
Yeah. Thank you for asking that, because this is, I think when you paint a picture in individual's mind, they are able to more clearly visualize why you need to do certain things. So first of all, acne is a term that's used to describe a process. So again, even mild acne, it's still acne, the clogged pores, et cetera. It's just a milder form. And it also has to do with frequency. And it also has to do with severity. So acne is not an infection. You can't spread it. You can't catch it. Now, when we look at the outside of our skin, we're looking at the stratum corneum. That's a dead layer. And those cells, we shed about 500 million a day all over our body. We're just not aware of it. They're microscopic. But when you look at a follicle opening, we call them pores, but they're technically sebaceous follicles. When you look at an opening, you're looking into a long hollow tube that's about as big around as the diameter of a hair. Now at the bottom, you have sebaceous glands. And one of the reasons we produce oil is not because it's going to keep you young forever. It's because one of the important things that it does is it takes the cells lining the inside of the follicle, which are very much like cells on the outside. And as they shed, it pushes them to the surface. They sit there and they fall off. That's the normal process. Now, we don't understand why exactly, but for some reason, in people that have acne, we haven't discovered the acne gene, but we think it runs in families. You could be the only one with it, the only one without it. It could skip a generation, but typically we think it's hereditary. For whatever reason, the cells stick together. Now, that forms what's called a microcomedo. You could have lots and lots of microcomedones and your skin could be perfectly clear. Now think about this. The definition or the onset of puberty is defined by breast development, not menstruation. So you could have a little 8-year-old girl. She's in puberty and her skin is beautiful. And it's beautiful when she's 9 and 10 and 11, and maybe she wakes up at 12, she's breaking out. But those microcomedones have sat there. And sometimes they're triggered with stress, or they're triggered with hormones, or they're triggered with all kinds of different things that can occur. But at that is the beginning of the acne process. It doesn't matter how severe your acne is, who you are, that's the beginning. Now, microcomedones can go in several different directions. So one is where the cells stick together and they stick together, and pretty soon the follicle dilates. You see that as an enlarged follicle, clogged pore, blackhead. You can extract them. They're back really quickly because it just pushes itself right back up to the top. You've done nothing to stop the process. Now, when it becomes more serious, is the cells sticking together and the oil trap C. acne bacteria. Now, C. acne bacteria is harmless. You can't catch it. You can't spread it. It's not an infection. You have it. I have it on the outside of my skin. You guys do too. It's when it's trapped in the follicle. So you can't just say, oh, I'm just going to get rid of all the C. acne bacteria in my body. It's part of your flora and fauna, so to speak. So it gets trapped in there. And what it does is it eats the oil. And it excretes a fatty acid byproduct that's very corrosive. Now, if everything just sat in your follicle, you might have dilated follicles, clogged pores, but you wouldn't break out, so to speak. But eventually, as that follicle expands and it becomes weaker, you end up with a leak. That could be near the top of the follicle. Material goes outside. It's treated as an inflammatory process. You end up with a papule, pustule, red bump. Nothing too serious. Not good if you have a whole face full. If you have a rupture lower in the follicle, it's deeper, more of an opening, more material goes outside, you end up with a nodule or a mini cyst. And that's where you see adult females. Where do you see it a lot? They're plagued, this area. And those are, you can't just extract them. We like to call them underground. They just have to kind of resolve, but there's ways where you can prevent getting them, period. But when they, and by the way, they typically don't scar. And let's define a scar. A scar is an injury to the dermis. Discoloration from acne is not a scar. That's the good news. So a scar would be where the tissue is compromised. You have a divot, you have a boxcar scar, you have a rolling scar, you have an ice pick scar. The tissue's compromised. We'll talk about that as well. Okay, so when the side of the follicle just literally blows up, you have a lot of material going outside, it hits the dermis. That's a full-blown cyst, and that's typically why you're more likely to scar with a cyst, because it's affecting the inflammation goes down into the dermis. Now, here I'm going to give you the solution, okay?
Oh, good.
Okay.
We like
so because that's what everybody's going, Jan, shut up. We just want to know what to do. Okay. Now, I always say you can do anything you want. You can go on TikTok. You can listen to social media, but what I'm going to tell you, there's no negotiation, no exception. Number one, we need to introduce something in the follicle that keeps the cells from sticking together. Now that's going to be skincare management. Okay, so that's the basic system. I got to tell you, if I'm working with an A-list celebrity, a world famous doctor like Dr. Cheng, they all go on the system. There's no argument. And the question that always gets asked is, but Jan, how can everybody be on the same system and have different concerns? Now, I'm going to give you an example. One product that's in the system. And the system, by the way, is numbered. Everybody uses a cleanser and a sunscreen, hopefully, so it's really 3 products. Cleanser, sunscreen, 3 products. Okay, so BioClear, number 3, is glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for acne. It's sold by prescription for rosacea. It's one of the best resurfacing agents we've ever seen for the appearance of fine lines and wrinkles. It's also a pigment lifting agent. It has a very synergistic, or I should say, it has a very antagonistic effect with active tyrosinase, but it makes a difference in pigment. Now, in addition, we have glycolic acid. Of all the skincare ingredients in the entire world that have been studied medically, let's say histological studies, biopsies, medical conferences, 2 have been studied more than any other. One is glycolic, one are the retinoids. Now, glycolic, at the simplest level, it dissolves and dislodges the glue-like substance or cellular cement out here. So that layer, that dead layer, stratum corneum, what happens is it should lay like shingles on a roof, like fish scales. It should reflect light. It's got lots of hygroscopic substances around it, mucopolysaccharides and ceramides and phospholipids and hyaluronic acid. So to be really smooth, and everybody wants glass skin, right? Everybody. And to be really reflective and to look moist and radiant, you got to have a lot of those substances. And that stratum corneum needs to be really thin and compact. Okay, thin and compact, thick dermis. Thin and compact, thick dermis. Now, glycolic acid, when it dissolves and dislodges the glue-like substance between cells, everybody says to me, when they've used it one night, they'll say, Jan, is it my imagination? My skin looks so much smoother. My pores look smaller. It looks so much more reflective. So it also stimulates the mucopolysaccharides, the ceramides, the phospholipids, hyaluronic acid. Technically, it's actually categorized as a moisturizer. It also, statistics show, studies show, increases the thickness of the dermis by about 33%. Wow. Now we can go beyond that, but guys, you tell me what product out there that goes 33%. Maybe some lasers, deeper TCA peel, but then glycolic has this tiny little molecule weight, and it goes into your follicle. We love to think all these things get into your follicle. It's not true. Cleansers, the molecules are too large unless they've got glycolic. A lot of things that we put on our face, it's not getting down there. The glycolic does. It's got such a small molecular weight that there are a number of prescription topicals that use it as a delivery agent. So it gets into the follicle. What does it do? Dissolves and dislodges the glue-like substance or cellular cement between cells. It helps to interrupt the acne process. Okay, now the system, and maybe this is safe for another time, it's got lots of other technology that makes a very noticeable difference in the appearance of aging and just overall how your skin looks. Now, there's a part 2 to this. And excuse me for going on and on, but part 2 is really important. Part 2 is duality. No exceptions. Now, duality is a product that has 2 chambers. You press one, you press the other, you mix it in your hand. So let me tell you what chamber number 1 is. It's benzoyl peroxide. And I know what everybody's thinking. Oh, Jan, benzoyl peroxide, teenage medication, dries your skin out, blah, blah, blah. This is not prescription. This is not infomercial. This is not mom's benzoyl peroxide. This is very different. This has been tested in Alberta, Canada by Dr. Jaggi Rao, who is a board-certified derm in the US and Canada. He's the head of the dermatology residency program at University of in Canada. Alberta, thank you. And he also is the CEO and founder of the Acne Clinics of Canada. Now, in the study, this was 20 degrees below, over 20 degrees below zero. The patients in the study, their skin was more hydrated after the study than before using this product. Now, what benzoyl peroxide does is benzoyl forces peroxide in the follicle, releases oxygen. C. acne bacteria can't live in oxygen. It kills it better than anything we've ever seen. That's a statement by the American Academy of Dermatology. And at the right percentage, you cannot develop a resistance. And so it's what we call bacteria static. It's not bactericidal. Oh, we used it once, we killed all the bacteria, never coming back. No, you have to kill it every day. Bacteria static. So that goes back to, if I miss a day, colonies are back. This kills it better than anything we've ever seen. There's no cure for acne. You manage it. You manage it to complete total clearing. Now, the second chamber is a retinoid. Retinoids are considered a gold standard for acne. They're considered a gold standard for rosacea, a gold standard for discoloration, and a gold standard for aging. Now, I'm going to spend a moment on this because we're talking about acne and aging, right?
Sure.
So this, I'm going to really oversimplify this, the so-called aging process. I'm taking it as a whole. So when your genes are made up of DNA, now some of your genes are what we call expressive genes. They express out an information sheet. It's like the software for your body. Imagine if you opened your computer and you didn't have any software, or the software was really corrupt. So when you're born, software is perfect. Your epigenome is perfect. You're in an anabolic state, growing and developing. And Mother Nature says, look, we're just going to overlook a lot of things because we got to get you fully cooked so that you can procreate. And so but everything you do and everything you touch, everything you come in contact with, I just touch my desk, it's in my DNA. If you ate crayons in kindergarten, it's in your DNA. Every bit of sun exposure, it's in your DNA. I ate chalk, but that was just, that was just me. Now, when you get around 18 to 19, right around in there, 20, what happens is you go into a catabolic state. So that's where you're kind of on the decline, but it's slow. You don't notice a lot right away, but everything we see internally and externally, that's where we're starting, we're aging. Now, what happens is essentially, it's kind of like a little switch gets flipped. And so all of these imperfections that have been etched into your DNA start to show up. And even in your 20s, people will say, oh, I noticed my pores are starting to look larger. My skin isn't as bright. Or people will say things like, make me look more dewy. Fine lines, all of these things. So this is everything except dynamic muscle movement. That's Botox. Mm-hmm. So here's where the retinoid comes in. Because, and there's nothing like this in the world. We got something close and complementary that we're going to be launching in February that's extraordinary. But there's nothing like this. The right retinoid actually corrects instructions coming from your DNA. That's a medical fact. That's not supposition. And it affects gene expression, but essentially it's correcting instructions. And so if you have a twin sister, twin brother, you're both using the same skincare, but one uses a retinoid and one doesn't consistently, the right retinoid, you could look 10 or 20 years younger skin-wise than your identical DNA twin. That's a fact. This is extraordinary, guys, because it can make such a difference when we can address acne and we can go after all these other concerns that we all have. And I'm going to tell you extraordinary. Now, doesn't replace cosmetic surgery. It doesn't. There's quality of skin. There's quantity of skin. There's all kinds of things that happen down in terms of your muscles and things that are suspending the muscles and all those things. That's a whole different issue. But I'm sure, doctor, you would agree that just because you perform a fabulous facelift, snaz, deep plane, whatever, that doesn't give the person really great skin.
Sure.
So, and you know, I'm gonna give away my age, but you can look as close as you want at me. I was 74 at the end of December.
Wow.
I keep old driver's license pictures. This is about my skin. And my skin is better now than it was then. So these are things that are really well within your reach. And we're kind of just biting off a corner of this because there's so many things that we can do today that will, whether you choose to go down the surgery road, which is everyone's personal choice, or and what you do to complement that, one way or the other. So anyway, that's the process. That's the solution.
Wow, I mean, that's very interesting in terms of, I've never known that retinoid can affect gene expression. So
Yeah.
maybe that's known in the literature, but that's not something that I actually knew. So that's pretty fascinating. Now, for your products that have the duality that has the retinoid in it, how do you think that compares with just the retinoic acid?
That is a really good question. And also I want to mention, my vice president of R&D, Dr. Saxena, actually put Retin-A Micro, one of the prescription products, through the FDA.
Oh, wow.
And over the years, he worked with the inventor, Dr. Kligman, who's been dead a number of years now, but arguably the most famous and brilliant derm literally in the world. He was the inventor. They didn't work, he wasn't an employee of Kligman's, but they worked together on a lot of projects. And so Dr. Saxena is probably considered to be the foremost retinoid expert left in the world today. So I feel very blessed. Now, when we talk about, and I think you asked the question about the difference between, like, say, prescription.
Right.
This gets really interesting. So when we're talking about prescription, we're talking about retinoic acid or tretinoin.
Mm-hmm.
And in your body, you have receptor sites for retinoids. This is one of the reasons why we can have some profound effects. We actually have receptor sites, alpha, beta, gamma.
Got it.
And these, for example, gamma receptor sites are probably 90% of them. They're 90% of the receptor sites on the surface of the skin are gamma. And one of the things they do is, boy, they can put your collagen on steroids. And then, so how the retinoids hit those receptor sites, how bioavailable, and it has a lot to do with the results you're going to get. For example, tazarotene or Tazorac was originally approved for psoriasis, and then it got approved for acne. I don't recall if it's been approved for aging, although people use it for that, but it hits receptor sites differently. Okay, so when you put a retinol on your skin, non-prescription, put a retinol, everybody has an enzyme and it immediately converts it into retinoic acid. You have no choice. That's just what it does. Now, when you have a conversion, you lose something. So sometimes you have to have twice as much, or 3 times as much, or 5 times as much. In this case, you've got to have 10 times more retinol to equal what you would have in the prescription. So if you had the highest strength of a prescription 0.01, 1/10 of 1%, you've got to have a full 1% of the retinol. Now that doesn't sound like rocket science, but here's the catch. Back when Kligman was first working on this and then licensed it, retinoic acid, to University of Pennsylvania, the first product, which was Retin-A brand, by Ortho. Ortho was the one that putting it out there. He actually said in the literature, and he said it throughout his, inventing years, that retinol is actually more bioavailable, probably works better. But the reason he didn't go with that is because when you take that retinoid or that retinol and you increase it by, say, 10 times, it actually becomes much more difficult to acclimate to. I used to joke it's like taking paint off your walls. So, how many people complain about the prescription? And imagine being much worse than that. And so when you go to department stores and drugstores, what you're seeing is very tiny amounts of retinol. It doesn't mean it's not a good product, but you're getting a very tiny amount. So that also then reinforces that notion that the prescription is so much stronger. Now, what we've been able to do, this is kind of very interesting, it's proprietary. What we've been able to do is we have been able to increase that retinol by 10 times. And so we actually, when you do that, you can actually go beyond in terms of the bioavailability. Now, there was a study that was done by derms on this product in which they concluded that 78% of patients had absolutely no side effects. That's using the equivalent of a 1% or better prescription. And 22% had maybe very slight acclimation, a little slight bit of redness, maybe a little bit of slight flaking, and which is easily addressed by saying, well, start it every other night. But you can use it consistently every single night. Now, in addition, we also have in these formulas, and we have more than one formula, for example, in duality, we have an ingredient that has been shown to lessen the post-inflammatory hyperpigmentation, the discoloration, acne discoloration by 300 times. We have an ingredient, we have peptides, we have anti-inflammatories. So there's additional benefits. And one of the derms in the study actually said, I will never again prescribe a prescription retinoid unless my patient begs me for it because this works better. Now, we also have Luminant, which is the retinoid with tyrosinase inhibitors and all kinds of other technology for discoloration, brown discoloration, or melasma, chlasma, etc. And that study has been written up in the Journal of Drugs and Dermatology, half-face comparison with prescription hydroquinone. We outdid prescription hydroquinone. We also have just the retinoid, this I call it the plain retinoid, but it has a lot of other complementary ingredients, but it's not for discoloration or for acne particularly. So there's a variety of different choices that patients have that they can address these common skin concerns. It's multifaceted. So I hope that answers your question.
No, yeah, that's fantastic. Sorry, I have another question that you
Sure.
kind of, when you're talking about your tyrosinase inhibitor, your product. Now, with hydroquinone, you can go on for a couple months, but then you have to take a break from it because of ochronosis that can happen. Now, with your product, do you have to take a break, or can you use it daily without any sort of side effects?
You can, and absolutely, and that is one of the reasons why. And believe me, I don't have anything against hydroquinone, but around the world, it oftentimes cannot be purchased over the counter, and it's even hard to get it by prescription because of that side effect.
Right.
Now, generally, we don't see that side effect at, let's say, a 4% prescription, the average prescription 4%. And in other places in the world, it's been known, and they do it in the US too, but they will prescribe 7 or 8% or more.
Yeah.
And you're right, it's not meant to be used indefinitely. And a lot of physicians feel that some of their patients, particularly Asian, will get their skin kind of starts to look a little grayish, not necessarily where they're getting that side effect, but that it's just not, it's not complementary with their skin tone. Now, so you can use this indefinitely. And there's actually several segments of technology. So one would be tyrosinase inhibitors, because guys, we can take, whether it's melasma, chlasma, solar litiginese, just brown spots over the years. And everybody, by the way, everybody by the age of 35, if you've got skin, you're going to have abnormal pigmentation. But we can take that, and one of the things that allows you to make pigment is active tyrosinase. If we didn't have it, you'd be an albino. So when you go outside, it's less than a minute. As an adult, that exposure is stimulating your body to make pigment, depending on your ethnicity, depending on your genetics. Some people, they start producing pigment unevenly sitting in a hot car, sitting around hot ovens. Other people, they have less of a propensity. So the important thing is we want to downregulate the active tyrosinase. And this doesn't happen. You don't have, I bet you, Kennedy, you've never had like a 14-year-old come into you and go, Kennedy, help me. Oh my God, I have a pool in my backyard and look at me, I've got brown spots and wrinkles. So again, this is all these things I'm talking about that's in your DNA. So, and this can get very complicated in terms of genetics and how, reactive your active tyrosinase is. So we need to downregulate that. Secondly, we've got something really unique. We all have a melanocyte stimulating hormone. Now, even if you have really dark skin, we produce about the same amount, although you can produce more if you're pregnant or on birth control pills. That plays a role genetically, how you react to the sun, how you react to these conditions. And we have a technology that downregulates that.
Cool.
Then we have turmeric. Now, turmeric is a very, very dramatic tyrosinase inhibitor, but when they've used it for centuries in India, it turns their skin bright yellow. So we found a way to maintain that activity and remove the color. And then finally, we've got the retinoid. And retinoids work differently than any of these other things. And it's much more progressive. But if you are consistent and you stick with it, it can be very dramatic for evening skin tone. Now, I'll tell you a quick story. Somewhere in my teenage years, when I was just an avid sunbather until I was about 24, I was born and raised in San Diego, California. I developed this big brown spot on my cheek, and it was very dark. And little old ladies sometimes would come up to me with their Kleenex and they, dear, you've got mascara on your cheek. That's how dark it was. And try to wipe it off. So one day, a dermatologist said to me, I think we should biopsy this because I don't think it's cancer, but we should biopsy. Well, I didn't want a biopsy. I didn't want a scar. And shortly thereafter, I started using retinoids. And I want to tell you, I can't remember exactly how long it took, but eventually that spot was completely gone.
Wow.
Didn't happen overnight. Retinoids also have the ability to prevent actinic keratoses. That's the beginning of a cancerous lesion. Sometimes they show up as little red spots. I can't go on enough, but we have that in there. So again, you're not just addressing the pigmentation, but you're also addressing the factors that are causative factors. And your skin is going to look younger, it's going to look better, it's going to look smoother.
Oh, that's fantastic. My two girls, so I have 4 kids, and 2 of my kids I have 2 boys and 2 girls. And so my girls started developing acne at the age of 13 and 14, and they tried all sorts of things. Unfortunately, not your products, Jen, but eventually they went on to Accutane. But so my question to you is, when do you think, at what age do you think young people can start getting on your products so that they can help their acne?
So first of all, I want everybody to know I don't have anything against Accutane. And there's certain types of acne congoblata, acne fulminans, in which if you don't do Accutane,
yeah,
that's it. And
right.
There's other reasons why Accutane may be necessary. but there's ways that you can treat people immediately after to maintain and manage the clearing. Now, with regard to teenagers, okay, so the way that I generally lay this out is if you've got this family history, mom or dad had acne, then it's probably good to start them. And I will tell you, Dr. Fulton, who's a derm, who is Mr. Acne, and he's again been dead a number of years, but he had horrible, horrible acne. And still, his face was still scarred. And he started his son and daughter on this regimen that I'm going to talk to you about at the age of 8, and they never had any acne in their teenage years. And this is what I recommend to a lot of parents. Now, you have to keep it simple, because here's the problem with teenagers. And I don't know how old your girls are. They'll go, oh my God, my life is over. Nobody's ever going to talk to me, want me, date me. I'll never get married because I have acne. But when you try to get them to use products consistently, no. And usually it's around, this is what I found, it's usually around 14 or 15 when they really start to want to be clear and be consistent. But you need to start them a lot earlier. So it could be right at puberty. If you wait till they start to break out, that's fine. But here's the routine. It's really simple. We make a 2.5% benzoyl peroxide wash. This is just for teenagers, okay? So they do that day and night. Teenage girls start PO, but it's the one that doesn't dry. We make a 5 and a 10, and they would use the 5% just at night. And during the day, they're going to use our sunscreen, which also has the oil control factor in it that only can go after oil, can't go after actives, so it's not going to dry out a dry skin. It leaves everybody else soft and silky, but they'll love that. Now, we evaluate them 2-3 weeks down the road, and we see, because generally this is very fast. So if they haven't plateaued, then we keep going. If they've kind of started to plateau, then what we do is we take them to the 5% day and night. And again, we evaluate. And if we need to, we take them to 10% just at night. We can take them to 10% eventually day and night. And I usually wouldn't even get to 10%. But the other thing that we can do if we need to is we can add in BioClear. We can add in a retinoid. My grandson, he really cleared up around 12 and 13. He was completely clear. And around 14, he got some flare-ups. And so I had him on 10%. And what we did is we added in the retinoid. We added in the BioClear. He's 16. He's completely clear, never breaks out.
Wow.
So those are the options, but we try to keep it very simple, and it's also very cost effective. Now, if we've got a boy, boys typically no acne, usually after 23, but sometimes their acne is more aggressive and more severe. So what we want to do is cleanser day and night, and we start them on 10%. And also, forgive me, but boys are more forgiving. So they don't worry about makeup. They don't worry about if their skin's a little bit maybe drier feeling. They're just not as, understandably, as quite as difficult sometimes to work with girls. And we keep them at 10% at night. Again, evaluate if we need to, we'll go 10% day and night. And if we need to, we can add in the BioClear, the retinoid. We also have pads that are teenagers and adults can use them, that they can do 2 or 3 times a week. And what these pads do is they're tremendous for the appearance of acne scarring. And by the way, I'm going to back up for a second, because the right retinoid, guys, thickens the dermis statistically by about 50%. And one of the recent studies said after a year continuous use, it can be as much as 90%. that's not just for lines and wrinkles, but what you're doing is you're pushing out those acne scars.
Wow.
It doesn't replace, it might not replace laser, but it can make a huge difference. I get feedback all the time. I'm going to the store now and I'm not wearing foundation. My skin looks so much better. So this really globally covers all of that. And it's comprehensive. And what these peel pads also do, they have something in them. Here's one of the reasons you get discoloration. So when that inflammation is making its way to the surface, it disturbs little blood vessels. These little micro vessels leak. They leak the color of blood, bilirubin, verdirubin. So what happens is it's kind of like staining, in a sense, that your skin, that acne lesion. If you have really fair skin, it's probably going to be red and it's probably going to go away fairly quickly. But if you've got more pigment in your skin, it can be brownish, purplish, even blackish. And what this does is this helps to prevent or lessen what happens with that leak kind of staining the skin. And it also gets rid of it faster than anything we've ever seen. And again, and the pads can help with, well, anybody can use them. We make one that is,
I love them,
just for adults. But this one is the Marini clear pads. Anybody can use them, but they're especially for acne. But they also help with the appearance of fine lines and pore size and all of that.
Love it.
So, by the way, one of the reasons we're discussing this today, because the Cheng plastic surgery practice, this is your resource, guys. You don't have to think about this as just you're going in and I don't know, having whatever procedure, but this is also a way to really develop a relationship.
Sure. Yeah.
These are individuals that are trained to be able to very quickly assess how to proceed. And I'm just going to tell you, we have so many different technologies that I always tell people, if you tell me a month from now your skin is as good as it's ever been, or can't imagine it getting any better, I can get it a whole lot better. So it's a journey.
Yeah.
And so this is a resource for you for that journey.
Well, thank you so much. I mean, yes, it's so valuable. I mean, we can do surgery, but the skin needs, after surgery, the skin needs care. Before surgery, the skin needs care, and surgery can't treat that, obviously. One of the questions I have is, acne is very inflammatory. And so, what are your thoughts about inflammation and rosacea and can you give us your thoughts on that?
Well, yeah, acne and rosacea are kind of related in that they're both inflammatory disorders.
Yeah.
Now, here's the difference on the surface. So with rosacea, you can develop secondary lesions. They're usually through here. Now, one of the differences is, number one, they're transient. So people go to bed and sometimes they have them and they wake up in the morning and, oh my God, they're gone. I wish that happened with acne. The difference is that if you biopsy a rosacea lesion, there's no microcomedone. And you can't have acne without a microcomedone. So with rosacea, it's strictly inflammatory causes. Now, historically, here's what we've been told, and it's in social media everywhere, it's the Demodex mite. Now, I'm going to separate rosacea into two categories. Mm-hmm. And the bulk of rosacea is not the Demodex mite, because there's study after study where they biopsy follicles that are just filled with Demodex mites. Person has no rosacea or mild rosacea, and they biopsy follicles that have a few mites, and the person has severe rosacea. So with run-of-the-mill rosacea, the underlying factor is something called a kisilicidin protein. Now, this is an inflammatory protein. It's a good protein. You need it for wound healing. But when we are compromised, primarily due to sun exposure, and fair skin is more likely for that to happen, and passive dilation and all this stuff, something happens with this protein where it's very reactive. So rosacea is not a disease of sensitivity. That's mistreating it. It's a disease of reactivity. What are you reactive to? Well, think about it. Oh, somebody says, I drink red wine. Oof. I eat spicy food. Sometimes it's chocolate. Sometimes it is working out, weather that's too hot, too cold, too humid. I could go on and on. So it's reactivity. Now, what we have to do is we have to down regulate those reactive pathways. And we do that with Rosalieve. We also do it as time goes on with a retinoid, with NeuroSmooth, because the microcontractions also contribute to redness. And we do it with the skincare management. That's the starting point. Because one of the most anti-inflammatory substances you can put on your skin is glycolic. Now, I used to, when I'd lecture at medical conferences on rosacea, I used to show, back in the days where we had slide trays, I used to show before and after pictures of rosacea just with skincare management that were extraordinary. But now we add in Rosalieve. And so there's no cure. Sorry, no cure. We can manage it. But you have to, here's the caveat. With rosacea, you've got to manage your lifestyle. That's not easy. You know,
Yeah.
If you drink your favorite red wine and that, bothers it, or you eat a lot of spicy food. So you've got to manage all of that, but we can manage it. And also, here's the interesting thing. With rosacea, one of the ways that we manage it, let me put it this way. Let's say somebody has acne and rosacea, because they can. They had acne down here. They might have some acne up here, but they've also got rosacea. And you're going, well, what do I do with this? How do I know the difference? What if I put something on it that bothers the rosacea? Well, do you know, I think it was in the last 2 years, they approved a specific medication for rosacea that's been used for other things. Works really well. Guess what it is? Benzoyl peroxide.
Oh, really? It's not Metrogel?
So you can put somebody on Duality, and you don't have to worry that it's somehow going to aggravate the rosacea. So I got to tell you, I've worked with so many people that have been on topical steroids. They've been on everything that you can think of. And actually, recently in Japan, one of the key opinion leaders spoke at podium at a big medical conference and said, we've never seen a prescription medication that works as well as Rosalieve.
Well, that's pretty fantastic.
Wow. Well, I can't believe our time here is almost
I
up.
can't believe.
Not quite yet, but
Wow,
did we get any questions from you? Somebody says, yes, I got acne when I was pregnant at 25. People are saying hi to you, Kennedy.
oh.
And somebody else says, we love you. So, yeah, anyway, that's so common. We always don't we hear all the time about somebody gets pregnant, they're like, oh my gosh, I was glowing and my skin was perfect, and it was just,
yeah.
It can be every bit the opposite. I get that all the time.
So, yeah, I mean, I guess we learned there's no cure for acne, right? So it just about, I guess, long-term management.
That's right. You can't stop managing it. One of the biggest questions you get, particularly social media plays a role in this, but people will say, oh, so when my acne clears up, I guess I can stop using this. No. I'm a good example. 74. I'll be using it. I'll be using it to the grave. So.
Yeah. No. No. We really appreciate your time. We know you're a very busy woman, and it's such an honor for us to be able to talk with you, spend this hour with you. You've been such an influence, entrepreneur, and innovator in skincare industry and the medical field. So, again, we're so thrilled and thankful that you could spend this time with us and share your knowledge. So thank you.
Oh, you know what? The honor is mine. It's really a privilege. And I'm looking forward to I think we have another one scheduled. I'm looking forward to our next one.
Yes.
Yeah, that sounds good.
Yes.
Yeah.
I'm looking forward to talking to you again, Jan. Have a great 2026 and the best to your family.
Thank you so much. This was such a pleasure. Thank you, everybody, for watching, because I wouldn't be here without you.
Thank you so much.
Bye.
Bye, Jan.
Bye-bye.